Hello, welcome back to another episode of Chairside Live. I'm Dr. Justin Shi. In this episode, registered dental assistant Will Schmidt discusses full arch PVS impression techniques, more specifically, impressions taken by dental assistants for night guards, snore guards, Invisalign starts and refinements, and any full arch impression that requires more detail than an alginate or Pentamix impression can provide. Take it away, Will.
Thank you, Dr. Chi. I want to focus this episode on a specific technique that I prefer when taking full arch diagnostic impressions. Today's demonstration is going to be performed solely on unprepared teeth. No retraction or temporization is necessary. Dental assistants perform full arch impression procedures in cases where Invisalign preparation, occlusal guards, and snore appliances require extremely accurate models to proceed. My process is similar to a two-step impression, but with a bit of a twist. One of the main challenges with two-step impressions is the difficulty in reseating the tray back into the mouth properly to avoid a step or a double impression. Debonding of multiple layers of material can also be a deterrent. Let's look at a different approach to avoid these common failures. My armamentarium for today's demonstration starts with Glidewell Direct's own Capture Soft Putty. This VPS material is packaged with separate base and catalyst jars and corresponding spoons. For the wash, I prefer Glidewell Direct Capture Syringe medium body material with standard 6.5mm mix tips, and then Capture Hard Bite Registration with a larger barreled 6.5mm mix tip to withstand the higher hydraulic pressure of the more rigid material. All materials can be extruded with a universal 1:1 by 2:1 mixing gun. I am also going to utilize a small single-use disposable plastic sheet that you can usually already find in your office in the form of a headrest cover or a seat cover and your plain everyday pair of paper scissors. The Capture Putty base and catalyst jars are color contrasted to ensure a homogeneous mix when activated. The spoons allow the putty to be removed from the jars without cross-contamination and easily dispensed, always in equal amounts. Closing the jars immediately after removing putty further protects the remainder from cross-contamination or from drying out. Starting with the thin plastic sheet, I cut a square just bigger than each of the trays that I will use for today's impressions. Since I used a headrest cover in this demonstration, I simply cut a folded square and then unfold it to cut into two individual pieces. Finish each square with a centerline cut approximately 1/3 into the center of each sheet. While mixing Capture Putty, there are a couple things to keep in mind. Be very aware of what type of gloves you are wearing during the process. Gloves with powder or added scents such as mint or bubblegum may actually retard the setting of the VPS material or prevent it from completely setting at all. Knead the material with opposing motions to ensure an even mix and remove any excess that you may find to be too much. Roll the putty into a cylindrical shape and place into your pre-sized tray. I always like to start with the easier lower arch to build patients' confidence in the impression taking process. Shape the material and then place the pre-cut plastic square over it with the centerline cut in the open space that the tongue will occupy. Place the entire formation in the mouth, press to seat as much as possible with hand pressure, check and make sure that the lips are out of the way, and then ask the patient to bite with firm pressure on 2 cotton rolls that are placed bilaterally at the first molar. If done properly, you should see the excess material squeeze through the locking holes built into the tray as shown here. Once the material stops squeezing out, ask your patient to open and immediately remove the impression tray. What we have created here is basically an immediate chairside custom tray. Since the material is still viscous, use finger pressure to remove any undercuts and form higher walls or troughs if desired. I can now put this impression to the side to continue to set and carry on with my maxillary impression. With a new clean pair of gloves, I once again carry out the steps of mixing the Capture Soft Putty and placing it in the impression tray. In this demonstration, I'm using a metal tray for the mandible and a plastic tray for the maxilla. During an actual treatment, I try to stay away from swapping trays between metal and plastic and stay true to one product. For the sake of this video demo, I want to show that the process is the same between each choice. However, if I were looking for the most diagnostic impression possible, my preference would naturally be a metal tray. Overuse of plastic trays compromise results with consistent discrepancies due largely to the elastic memory of the tray when impinged on hard tissues inside the mouth or from firm pressure holding the tray in place. Once again, placing the maxillary tray in the mouth, I ask the patient to bite on 2 cotton rolls and quickly remove the tray once the material stops extruding out. I make a quick sweep to manipulate the flowable putty if desired, and I can immediately move back to my lower arch tray. Now the plastic sheet can be removed and I have a VPS custom tray that is not only set, but largely free of saliva integration. One more common challenge with 2-step impressions. Moving on to the wash phase, I choose Capture medium body syringeable material. I prefer the medium body in this situation because it is going to make up the bulk of my accurate anatomical impression, so a bit less viscosity is beneficial. I make sure to bleed the cartridge when I place a new mixing tip on it. Get into the habit of doing this every time. An uneven, unmixed start leads directly to a failed impression. Extrude the wash into the tray while keeping the mixed tip buried in the material to prevent air bubbles from getting trapped and forming pockets. Fit the tray back into the mouth and seat into place. Since our initial putty phase did not render undercuts or tight areas, our worries of double impressions are an afterthought. This chairside custom tray is also preventing excess from oozing out and into the patient's throat. At this stage, hold the tray in place with finger pressure and never by asking the patient to bite on cotton rolls or anything else. Our impression comes out clean and without error, so we can move on to the opposing arch. The custom tray feature really comes handy during the maxillary impression to prevent posterior loss of wash material into the patient's throat. Most dental assistants will be on their own during these stages of impression taking, so the less variables that have to be worried about, the better. Once again, a perfect impression on the first try is a predictable outcome. In cases where bite registration is necessary, a fast-set registration material such as Capture Hard Bite is an ideal choice. The 1-minute set time prevents the patient from tiring and slipping out of occlusion. Don't forget to always bleed cartridges, especially when opening a fresh tube. This material flows at a nice consistency to be able to be spread at an unrushed pace while also stacking to accurately register the bite. Asking the patient to bite and then to smile at the same time will enable you to have an appropriate field of view during the setting process and make sure the patient has bitten correctly, even though you practiced this stage with them in advance. Holding the set material down with finger pressure helps the patient to open and prevents ripping of the registration. Be persistent on developing impression techniques that make the flow of your practice smooth and your patients happy with the outcome. Capture Putty and VPS bite registration materials are always available for purchase through Glidewell Direct. Thank you for watching today's demonstration. Right back to you, Dr. Chi.
Thanks for those clever tips, Will. On behalf of everyone here at the lab, thanks for watching Chairside Live, and we'll see you back here next time.